Thank you for joining us on this fine Thursday afternoon for another EMR-approved Learning Lunch webinar. Our topic today is how to dictate and still meet meaningful use in the era of electronic medical records. Many clinicians, as you all know, I'm sure, are looking for ways to facilitate better patient interaction while also trying to engage in meaningful data submission. And although that is the goal, of course, of meaningful use, it's not always as easy as it sounds. So we've invited some knowledgeable friends from the ChartLogic team today, Chris Birch and Patrick Hobbs. ChartLogic is one of the industry leaders in speech recognition tools for the EMR, so they are the perfect people to give us a little presentation on this topic. And with that said, I'll turn it over to Chris and Patrick.
Let me introduce us real quick. Patrick Hobbs is a territory or regional sales manager here at ChartLogic, been with us for some time. I myself am a practice efficiency consultant. I've actually been involved in the lives of hundreds of clients over the last couple of years, making sure that they can meet meaningful use and making sure that ChartLogic as a company was able to get our clients that do use voice recognition technology for their note generation to that point. So I'll kind of let Patrick take over and just talk to you guys briefly about a few things, and we'll kind of go from there.
Yeah, and I'd like to thank Wendy for inviting us today, first of all. And I think one of the reasons that ChartLogic was invited to present is our approach to EMR is probably a little bit different than most vendors out there. And I would describe the distinction between the two as traditionally we see EMR or EHR solutions more of a point-and-click solution. And what that requires, as the audience probably knows, is anywhere from 50 to 80 clicks to actually go through from checking a patient in to going through the encounter and perhaps doing a super bill at the end of the visit. What ChartLogic does is we are a note-centric, voice-specific EMR application. So what we're going to be discussing today is how you can use dictation and qualify and attest for meaningful use. So first, I guess right out of the gate, we'll talk a little bit about ChartLogic and who we are. ChartLogic was developed by a couple of physicians, and I think because of that, the product was created with the exam or the encounter in mind. So, another one of the distinctions that I would throw out there is everything in the ChartLogic application really evolves around the node itself, and I guess portion of the software is really powerful. The second point is we've been in business for 18 years. During that entire time, during the entire existence of ChartLogic, we've used and adapted voice recognition into our software. So we're very adept and experienced in leveraging voice recognition as it relates to EHR. One of the other distinctions I would make is that with our voice recognition, you're not limited in terms of where you can go and what you can do in the actual application using voice. And we also do not run, let's say Dragon on top of the software. The voice recognition portion of the software is fully integrated into the application. The last point I'll cover is ChartLogic was actually the first EHR company to qualify for meaningful use. So we were the first company to be certified by the Department of Health and Human Services as a meaningful use certified application.
So folks, we just wanted to take a moment and let you know, really who we were, why EMRapproved.com has asked us to present, that question, how can you dictate and achieve meaningful use? Our clients have been doing it successfully for a couple of years now. Hundreds of clients have met and achieved meaningful use. using a combination of techniques that we'll talk a little bit about today as we go through meaningful use requirements. We don't want to spend a lot of time getting into the nitty-gritty of every single requirement for meaningful use. I'm sure most of you have probably been beat over the head with them over the last couple of years. The reality is there's some core things that you need to know to get by. The first is you have to have a certified technology. A lot of EMRs out there, really to the tune of probably 600 or 700. So you want to make sure that whatever EMR you go with or you're trying to achieve meaningful use with is certified. There's certain things that as a vendor we have to do to certify, and we'll kind of talk about that. But they're designed really to make your life a little bit easier. In terms of what you have to do as a clinic, there are 15 core measures that every clinic must attest to and meet. And then there's a set of menu items. There's 10 of those that you choose 5 of as a clinic. And that's a real basic overview. We'll talk a little bit more in depth as we get into how you can meet those requirements with voice dictation or with a voice-driven technology. But we just want to make sure that we kind of cover that overall and let you guys know a general idea of the requirements.
Next, we're going to talk a little bit about the balancing act as it relates to qualifying and attesting for meaningful use. You can see as part of our graphic, on one side of the balance, we have regulation and data capture. And if we're honest, there is potentially some extra time and therefore some money involved in I guess abiding by those regulations and being able to capture some of the meaningful use data that the Department of Health and Human Services is asking for. And the other side of the balance, obviously, is the patient care and the provider time. So the key for any practice is going to be finding a solution that enables you to balance those two things and potentially still qualify for meaningful use.
So, folks, we're gonna take just a quick minute here and show you what over 300 successful meaningful use attested clients of ours have done to reach meaningful use. It'll probably take just 30 or 40 seconds here to go through what they do, but EMR is here. It's not going away. The latest numbers that we've seen suggest that 70+% of practices have adopted at this point in one way, shape, or form, as I'm sure all of you on this call are aware. So it's here. It's not going away, and hopefully we can show you some tips and some tricks that you can, with your EMR or with another solution, be able to achieve meaningful use and achieve that balance Patrick just talked about. So you are going to see me go through some stuff very quickly with my voice. I'm not typing anything. I'm just using my voice to navigate around here. This is very similar to what our physicians actually do in the clinic day in and day out. So I'm not going to go through a whole thing here. I want you guys to see what you can do with voice dictation and still achieve.
And just to let you know, this is the note that I referred to earlier. This part of the software, this part of ChartLogic is completely customizable. So really any practice, any provider, if they have exam forms, etc., that they like, they would conceivably be able to keep, and we would simply integrate that into our product.
Right knee pain, 3 weeks, moderate severity, modify context system. This 51-year-old female patient presents with a 3-week history of right knee pain and associated buckling period. She states that when she walks, it feels like her right knee is going to give out period. She rates her pain at a 6 out of 10 and is having difficulty working because of the pain period. Modify GI. History of acid reflux, which is controlled with medication. Go-to physical exam. insert E1. So I'm going to stop there and just, we're going to go back to the presentation. This is how our physicians utilize voice dictation to get through an encounter, to get through a note and a chart, and still achieve meaningful use. So what I'd like to do is hop back over and just see if we can identify those areas where we need to meet meaningful use. So the first question is really those data capture pieces. So a large number of those menu items as well as those core items are actually tied to data that you're supposed to capture in your EMR, in your medical record. A lot of this, folks, is data, contrary to popular belief, data you already capture. So demographic data, age, sex, some new stuff that a lot of clinics have had to implement in terms of ethnicity and preferred language. Demographic data that hopefully you've been capturing for the most part for a long time in your practice management solution that should carry right into your medical record. Additionally, there's some more specific exam or patient health record related stuff in the form of medication lists, allergy lists, health history from smoking status, vital signs. Those all need to be captured as well. Now there's a myriad of ways that these are captured, but the key thing is they're all data elements, which means they do have to be recorded in some form of discrete data field. Dictation alone doesn't always do this for you. So a lot of times these are items that need to be typed in by someone or checked off in a checkbox. These are items that some of our doctors do use voice recognition to do, but the vast majority of clinics out there that we talk to, that we've helped achieve meaningful use, or that we've just talked to in a fashion similar to this, they indicate to us that most of that stuff is done at the time of registration, at the time of that initial appointment. And the good news is, with the exception of vitals, it's merely updates that are being done by your medical staff. Additionally, more and more with EMRs these days, we see a lot of that stuff being done by the patient themselves in the form of a patient portal. So instead of having your staff spend the time to do all that registration, all that manual entry of data, instead your patients are doing that for you online and are able to provide that stuff to you in a format that you can actually just move straight into your EMR without any manual entry at all. We've seen numbers in our own clients. Over 70% of patients that receive an email out of our portal open it up, go to the portal, and register. It's a pretty staggering statistic that we've found just over the last month or so. So patients are buying into that idea. Now I want to flip back over to that encounter just so we can look at those pieces. Now, I didn't dictate any of those. Those are actually stored as data elements. You can see the tobacco here, the name, the date of birth, the age. There's other items that you don't see on the note itself because they don't have to be on the note to meet meaningful use. They have to be in the chart, and if we look at that patient's information, we'll see things like the race and the ethnicity, but they don't have to be in the note. They don't have to be dictated each and every encounter. Now, vital signs do need to be recorded on your patient, but those are here and usually done as part of that patient's initial workup, not something always done by the physician. So when we ask the question, do we meet those particular data capture elements, the answer is yes. What we've done so far does meet those particular elements of meaningful use. There's some other elements of meaningful use out there, what we kind of look at in the form of patient care that are more, I would say, provider-oriented. They're more of the things that occur in the course of patient care from visit to visit that aren't necessarily things you capture at that registration point. And those are things like your problem list, patient-specific educational material, formulary and interaction checks, order entry or e-prescribing currently. So those are all items that happen through the course of one visit or another of your patient that need to be documented, that need to be done in order to achieve meaningful use. Now, what I'm going to show you is what our providers do to meet those particular requirements in the software. So right now, as it stands in the note, we've not done these things. These things are still undone. I've not done any orders. I've not documented any of that stuff. So what I'm going to use is a tool that we call Diagnosis Director. Diagnosis Director is a tool that a lot of physicians use with their voice and a combination of clicking to quickly finish out a note, to indicate their orders, to indicate their procedures, their educational material, all in just a couple of seconds. Again, using my voice as the primary method of navigating these screens. Diagnosis Director. And you can see as I open these up, I may have particular procedures, orders, injections, x-rays of different things that I do inside of an encounter that I can very quickly check off, as well as my office codes, textual representations of how I'm going to deal with that in terms of my plan, educational materials that I can provide to that patient in a printed fashion right from this screen. And so for our providers, they merely choose what they want, they click OK, and they're going to see all of those different things established right there on screen. So when we go back and we look and we say, did we meet those items, the answer is yes. Now I want to talk about a couple of these in terms of order entry, the formulary checks, the interactions. If you have a certified EMR technology such as ChartLogic, those things should be there automatically for you. That's an area of certification that to achieve full certification, your vendors have to do. And so what that means ultimately is when you go to e-prescribe something, those formulary checks, those interaction checks from drug to drug, drug to allergy, those should alert you automatically. Those should be something that you don't really have to interact with too much unless it is an issue that you need to deal with. So in what we're doing today, you've seen those things actually meeting meaningful use. The next area is kind of that post-visit communication, those transitions of care areas, things like the clinical summary, the actual transition of care documents when you send a patient to another physician or you're referring back to someone that sent a patient to you, access of those patient records and that patient information by the patients themselves, lab data coming in and out of the program. Now we haven't really talked about this, we haven't gone through this in what we're showing you in the product. What our clients find from ChartLogic and what others find from some other certified technologies are that a lot of these things are automated. For instance, when I finish out a note, when I decide to finalize a note, those clinical summaries are automatically pushed out to the patient portal for your patients to go look at. For some of our clinics, they made the decision to print those. And so as that patient visit occurs, they can choose to print out that summary at the end of the visit to have the patient walk out the door with it as well. Transition of care documents in our system, those are oftentimes done in the form of referral letters, sending letters out to referring physicians, including the encounter. Right now, they're done in a fax or a printed formatting. Hopefully here in the next little while with the changes to certification for stage 2, we'll be able to start sending those electronically to other practices regardless of which certified technology they're using. And then lab data, of course, can be brought in automatically through either a health information exchange or through labs directly into your system. So I just want to show you real quick what our providers do in a referral situation. So you can see how they, again, with the use of dictation and voice recognition technology, are able to achieve some of those pieces of post-visit communication very simply, very easily. Insert signature. referral reply letter. So very simply, they're able to send out a referral letter, again with that use of their voice, include a copy of the encounter if they'd like underneath it, and that's that's all there is to it with voice. I mean, it really does help speed up a provider in providing a lot of elements of meaningful use, a lot of things that clinics are honestly worried about eating up tons of provider time when they document. The idea is, as we said before, to really balance most of that stuff so that your patient care doesn't suffer, your provider time doesn't suffer, you're able to see the same number of patients without sacrificing any of those things and still meet that federal requirement. And that's something that 300 plus clients of ChartLogic have done in the past 2 years, and even more coming. Now, there's one other element to meaningful use that I do want to talk about, and I'll say this. The reporting stuff in meaningful use, the good news here again, guys, is that any vendor that is certified, is fully certified, has to have these reports in place. They have to have these capabilities to transmit data to public health agencies, to do the quality reports and everything built right into the software. So for you as a clinic, these shouldn't be something that take up any provider time at all or impact your patient care at all. They're things that are done administratively by your administration staff and should be something that's very simple to pull up, to access, to read, to transmit to these public health agencies, and not something that should really inhibit your workflow at all. But not something that's really impacted in terms of the provider's life. So there's not a lot of dictation that really takes place here. So our note, just by the essence of it being there and meeting the other requirements, are going to fuel these reports and these data transmission techniques. And so you're going to meet those areas, those elements of meaningful use as well. So guys, I know that was relatively quick. It was probably about 30 minutes or so. I know that quite a few of you have actually been sending some questions through the chat, and we want to be able to answer as many of those as possible. So we're going to kind of start looking at them, and we'll grab a couple here. So some of the things that I've answered a lot, folks, throughout time doing medical records and practice consulting, especially with meaningful use. One of the key things with voice and with dictation is will it work for me? Will what you showed me on the screen, is that something that's years of your training, or is it something I can do out of the box? And I'll tell you today, versus even 5 years ago, the answer is absolutely. 15 to 20 minutes of voice training with a voice engine such as Dragon, and you're going to get the kind of recognition accuracy that you saw running through that note. It is something that a lot of providers are incorporating into their EMR, into the types of areas that we showed you, those exams, those plans, those history of present illness, so that they can free dictate a lot of that information and still meet those meaningful use requirements.
One question, and the question is, will these webinar slides be available at a later date? The answer is yes. Wendy's going to be able to provide that to anyone who is interested. In addition, we would be able to do the same. Our contact information is is listed on this last slide. And any questions at all, feel free to fire away, and we'll be glad to answer those.
So Patrick and Chris, this is Wendy from EMR Approved, signing back in. Hopefully everyone can hear me. Sometimes the chat window on these webinars are a little tight. There are a couple of other questions. One, the other question is, from your perspective, do you have an answer for how this voice activation version differs from some of the others on the market?
You were kind of a little hard to hear for us, so let me just make sure I have the question right. You were asking how is this, what was kind of shown today, different than some of the other systems? Is that correct?
That's correct. Just one of the questions up here on the webinar was in what way is the voice activation tool that you folks were using different from perhaps some of the others that someone might be using with an existing EMR?
So let me make no mistakes, folks. I'm using the Dragon speech engine. Particularly on this machine, it's Dragon 10 Medical. And that's what the back-end speech engine that is in our software. The key difference, folks, between what you saw today with Dragon and what you may see with Dragon if you just go purchase it and put it on top of another EMR is, in most EMRs, you're very limited in terms of where you can put free text. So instead of seeing everything compact on one single screen and being able to quickly navigate, you might have to go into 3 different windows to find that box where you can do some free dictation. And so you're still doing a lot of pointing and clicking to get in there. And the reason we don't have that issue outside of just that single screen approach to a chart is really how long we've been working with Dragon. So the things you saw me do, pulling up stuff with my voice, navigating around, moving, inserting, modifying, those are all custom to ChartLogic. Those are all things that we do with Dragon natively in the program. So I don't have Dragon running outside of ChartLogic, outside of my EMR. It's actually tied right to the program. So it's been developed around that voice recognition. And being able to really provide an ease of use versus slapping that on top and hoping that the right areas you can do it in. So I'm not trying to discredit other vendors. Other EMRs certainly have some great voice capability, especially as voice has improved over the last couple of years. But the point here was to show you that it is possible. The data elements that you need to capture aren't necessarily the elements that the providers are going to be dictating anyway most of the time. And so you can really see that in our software.
The other question, and I'd like to address it just quickly, that somebody mentioned was, have you noticed in your follow-up with your folks that are attesting via this method if you have a lot of specialists? And I will just speak to that quickly, and then I'll let Chris speak to it as well. In my consulting business regionally, we have several specialists who regularly use voice activation, speech recognition for the purpose of their daily operations and their patient encounters. And I will tell you that one in particular is a podiatry practice, 12 site locations, and multiple practitioners. I would say I believe we have 19 practitioners in that group. That's very specialized specialty clinic, has used speech recognition in depth regularly with their client base, and they have attested for meaningful use and successfully received their high-tech funds, and they do almost all of their operations using voice and speech.
So yeah, I mean that's very similar, Wendy, to what we've experienced. Now, just so you folks know a little bit more about ChartLogic, ChartLogic, like Patrick said, we've been around about 18 years doing EMR, and in those 18 years we've amassed a client base that really spans across every specialty out there. And I have to say that we probably have clients in just about every specialty that have attested and received, if not, their first year, they're already in their second year at this point, and they received at the beginning of the year. So it is extremely possible for specialists. It's not designed for primary care. It was one of the things that a lot of folks thought meaningful use was just designed for primary care and was going to require you to do all this extra stuff that doesn't really impact a specialist practice. And the truth is there's exclusions for a lot of that. And there's also, a lot of broader things that really don't have an impact on a specialist that they're collecting anyway. So it's very possible. The vast majority of our clients are specialists of one sort or another. There's probably about a quarter of our clients that are in that primary care world. So for us, it's been very successful across all specialties, not just in primary care, but in orthopedics, in pain management, in ENT, ophthalmology, really you name it, and we've had clients attest and successfully receive payment from the government on meaningful use. And all of that, folks, again, without having to really sacrifice anything in patient care or provider time. Their doctors aren't spending any more time charting or dealing with the patient than they used to, or any less. So it's really been a good thing for our physicians.
Well, thank you so much, Chris and Patrick from ChartLogic, for your presentation today. If any of you in the audience have additional questions regarding the methods that these folks demonstrated involved in achieving meaningful use with voice activation and speech recognition, you can certainly contact the advisor consultants on my team at EMR Approved. If you'd like to speak with Patrick or Chris directly with some direct questions about their solution, as well as maybe some more general questions about this meaningful use method, please contact us at emrapproved.com. You will receive a follow-up email to this session with a direct link to a video version of this presentation in case you'd like to share it with someone. And you'll have some contact information in that email as well in case you'd like to ask some additional questions. So thank you very much for joining us for this Learning Lunch webinar on September 20th. And we hope that you'll join us for the next one when you receive an invitation in follow-up to this session. Thanks very much.
Thanks everyone.